we're going to show you how to take with the phosphorus plates, a complete mouse series. So we're going to just show you an anterior and a posterior and a bite wing, and we're going to show you the instrument setup for the phosphorus plates. These are XCP instruments. We have anterior, posterior, and a bite wing. And our anterior one is the blue one, and so we'll set our instruments together. I like to use a cotton roll because it gives the patient something firmly to bite on. We'll put this together, put our instrument together. Okay, the blue. Then again, our ring is centered. I center that over the bite block. It's for upper anteriors, lower anteriors. Okay, it's for our anteriors. I'm going to take posteriors, put that instrument together. Cotton roll. Gives them something to bite on. Makes it easier for the patient and for you. I like to use these notches in the bite block that are to the front. It's these ones right up here in the front. I use that one. And I'm going to use the ring. There's two rings. This is centered, this is off-centered. So this is our posterior ones, and the colors match up. Yellow goes together. We center this ring over the bite block. And this is for this upper over here and the lower over here. This bar needs to always come out of their cheek. Then if we're taking the lowers, we would move that bite block around, turn it once, and then you want to center this ring over the bite block again. And that's for this lower on this side here. Again, just one turn and one turn. So once your anterior is together, it's fine. The posterior is the one that you have to change it when you put your instrument together. Then we have the bite wing. It's that smaller bite block, or rod. You put that on there, and then we'll use the ring that is centered from the anterior. Okay, and this is for this side of the bite wing and this side of the bite wing. Right side and left side, and this, remember, this always comes out of their cheek for the bite wing. And you put it together kind of like an airplane wing, if that helps you, like that. Okay, and gives them something to bite on when you take the film right here. Okay, so I like to, when I start taking my films, I'll start with anteriors. I'll set our instrument together, and I'm going to put so we have two sides of the plate, our phosphorus plates. One has the X and one has the black. When we take our radiographs, we want to see the black. We want the A. There's an A here on here. We want that to go into the slot of this bite block, this being the slot. And we put that always into the slot of the bite block so it ends up at the incisal edge of the tooth and not the apex of the tooth. We want to see around that apex. Then, to make our film stay a little more secure in our bite block, we'll use this little sticky piece on here, so it makes it stay secure into the bite block. And I flip it around, I just make it secure around the film edge here, these covers. And putting your film into the bite block, you're going to kind of pull back a little bit, and then your film will slide right in. And you want to be sure it's centered on that back side, your film is. And when you look through that ring, you want to see black. You don't want to see the X, okay? That helps you. Okay, so we're ready. It's always good to work over the counter when you're putting your instruments together. Okay, so we're going to start taking our films. You grab your tube head over here. And our film is vertical, so we're going to change our tube head to be vertical. And we're going to start with our anteriors. So that's right there. Those are our anterior setting. We're going to open Dexter up here, and we want to get it behind our upper centrals. And then you always bring your bite block up to their upper teeth and have them bite. Get it behind the teeth you want to see. So with XCP, this is the XCP instrument. It stands for X-ray cone paralleling technique. And we're going to get it behind the teeth you want to see and have them bite firm on that bite block, and then you line up that rod and the PID to be parallel. Then you come out here and make your exposure. Okay, you push the button down, make your exposure, go back in, you look through the window to be sure they haven't moved. And you'd grab that out, and then you'd want to take a Kleenex right here, dry your film off, and I would take your little sticky piece off and drop it into the cup. You don't want to touch that cup, you want to keep that cup clean. So that's our anteriors. Now we'll take a posterior film. Okay, and again I like to use my sticky piece and I wrap it around that plate. I put the A into the slot. Find the A, goes into the slot. And then you pull back on that yellow piece and your film slips in there. Okay, now we'll take a premolar film. This is a posterior. And I'm going to take a premolar, so I'm going to set my setting. And our film is horizontal, so I'm going to change my tube head here to be horizontal. I'm going to get my distal, my canine here again. You want to get it behind the teeth you want to see. So I'll take a premolar. I want to get my distal, my canine. Get behind the teeth you want to see. Have them bite out far in the end of that bite block. Bring it up to their upper teeth and have them bite. Okay. And then bring up that ring in close approximation. And you're going to line up this rod and the PID to be parallel. Okay, that looks good. That's for our upper premolar. You come out here and make your projection. You want to hold that down and always look through the window to be sure your patient hasn't moved or the tube head. You want to grab that out. Okay, that's our premolar. Now we'll take a bite wing. You're going to dry that off good always. Set it in the cup. We'll take a bite wing. With our bite wing, now we don't use a cotton roll because we want them to bite firm here, to be biting together. And to put the bite wing into our instrument, you kind of just like pop that in. And if it doesn't stay secure, again, you could use one of these little sticky pieces. Otherwise, it has a tendency to move around. And it stays more secure with these sticky pieces on here. And then also, this is like the barrier, and if it's kind of big for your patient, you can use the little sticky things to make it a little smaller for them if it's not comfortable. Again, I go into the bite block, you just kind of place it in like that. And I use the ring that was on the blue one. It's the one that is centered over that bite block. You want to be sure that's centered. And you're going to come in here. We're going to take a bite wing. You want to change your setting always before you place it in their mouth. And then again down here for my angles, I'm going to come down here and I want to get the max. I'm looking at my mesial and my maxillary first molars. That's the contact I want to get open, and I want to get my distal, my canine for my premolar bite wing. Okay, that angle looks good. And then I'm going to get in between his tongue and his teeth. Okay. And then I'll have a bite down here. Okay, looks good. Okay, bring that ring close up. Again, want that rod and that PID to be parallel. Okay, that looks good. Sorry. Okay, and then we'll go out here and make your exposure. Be sure you always look through that window. I haven't moved. Go in and grab that out. Okay, that's our premolar. Then when you're done taking films, I'd put this up against the wall. That's out of the way for the next person. And dry your film off. Place it in the cup. You can take your sticky pieces off. And you can reuse those. Be sure you dry your film off. And you can, reuse your Kleenex. And then when you'd be done taking your pictures, you take your gloves off. And then you'd want to have clean hands, and you'd want to take your cup and go in to scan your radiographs.
Once you have taken your radiographs, you will come into the scanning room, and the first thing you will do is you will log into the computer to select your patient. And once you've selected your patient, you'll go to Just Get Card. And this is the yellow card. This is the card that you'll always get into when you go into your patient record. We'll go over to radiographs. This is our radiographic request screen, and this is a screen that when you come up to log in, and we need to see this before we give you your plates. Your faculty will authorize the radiographs here on this screen, and then we will give you your plates, and then you will go get set up. Now we're going to log into our scanning server, which is called MyPax. And we're going to pull up a complete mouth survey, so we will go up to the drop-down box and we'll pull up the CMS 20. We'll go over to the grid, we'll click on that, and then we'll click on our icon for the scanner. Once we click on that, it becomes active and our scanner turns on and it's ready to be used. I'm going to have Karen come over here. Now she would put on gloves. She'd put on clean gloves to open up these radiographs. And this is our transfer box. This is the box that we use to open up the radiographs, and we place them on this box. Do not touch this box with your dirty gloves. We keep this very clean. So Karen, if you will come by here, and I'll show you tell you how to open up these barriers. There's a notch at the end of these barriers, and that is where you will open up the radiographs, and you'll just shake them out onto this transfer box. Now these can be put on top of each other, they can be put on either side of this transfer box, and it doesn't really matter for sure, and it doesn't matter which, how they, yeah. We always want to have the X up. If you take them out of the barrier and the blue shows, that's the radiated side. If it is exposed to the light, it will erase its image. So you would have to either take your gloves off, turn your film over, and then put new gloves on to continue opening up your plates, or if there's someone here in the scanning room that does not have gloves on, they could turn it over for you. So now we have the radiographs opened up, and we're going to put them in the scanner. And there are 4 places to put in the scanner. You'll take your gloves off before you handle your radiographs to put into the scanner. There are number 1 and number 2 slots for this scanner, and the guides have a little slot on the very end of them, and that's where you put the radiograph into. So first we want to have the blue side towards the scanner because that's the radiated side. So we'll put it in the vertical position, and we'll push it down until it's flush with the guide. And then you'll see where it comes up here on the screen, and it's going to show you the plate as it is scanning. Now, as long as that turquoise color is there, you would not want to put another radiograph into that slot, otherwise it would get stuck together. It also shows on the scanner, it will turn yellow when there's one inside that guide, and then it'll turn green when it's ready to accept another radiograph. The radiograph appears on the screen here. Do not touch any of this with your mouse before everything is done scanning. Otherwise, if you happen to click on one of these images while it is scanning and you have multiple films, it will only accept that one. So now we'll go to the next one. We've got a number 1 guide here, and we'll put our number 1 film in here, our anterior film. Again, we'll push it down. You can see when you activate it, it turns yellow, and it shows that there's something in that guide, so you wouldn't want to put another one in there until that clears. Like, it would look like that. I'm going to put a number 2 in. This one is available, so we'll stick that one in. And then our last film is a number 1. We'll use this guide right here. It takes a while before all of them get through, so you have to be patient. If for some reason you're waiting, a film isn't coming down, go back over here to your scanner and make sure that you push that plate down and get it engaged. That's all, yeah. I guess we just took the 3. The red light, you will see as the plates are scanning, what that red light does is it erases the image as it is coming down through the scanner. Once that red light is off, then we can go over here and we'll click on Saved Images. Now this will put them up wherever. It doesn't mount them for you, so then you will have to go up here, left click on the image, go up to this blue arrow right here to rotate it, to put it in its proper position, and then you will need to mount the radiograph. Once these plates have dropped down here on the shelf, they are ready to be rebagged. And we have the bags, the barriers number 1s and number 2s at each station, and you can rebag these and can be used right away again. When you bag the barriers, you will want the A to be upside down, and you will put it in the barrier so that you can see the X. You want to push it down into the barrier tightly, and then you will take this white and you will just peel that off, its adhesive, and seal it, and it's ready to go for the next image. You can put it inside these little boxes that we have again at each station. The number 2 will be bagged exactly the same. So again, you want to put the A to the top, or if it's easier for you to remember, the number will be upside down. And push it down into the barrier so that it's tight, and take the adhesive and peel that off, seal it, and put it into the box. After that, after the mounting, Karen and I come in and we evaluate every film that is taken back here, and we will have you, if there's retakes, you will go out and do your retakes. If not, Karen and I will save them and approve them, and then you will go get your patient, clean up, take your patient back to your cubicle.